The NICU is an intensive care unit designed to take care of tiniest patients that come to the University of Missouri-Columbia. My name is John Pardalos, and one of my hats is I'm the medical director of the neonatal intensive care unit over at the Women's and Children's Hospital.
My name is Judy Bildner, and I'm the nurse manager of the neonatal intensive care unit.
My name is Dossie Sloop, and I'm the clinical social worker for the newborn intensive care unit at Women and Children's Hospital.
Most of our babies are actually term babies who either have an infection when they're born, or they get pneumonia, or they have congenital anomalies that we have to deal with. The other half of our babies are premature babies, which is what everyone thinks of when they think of the neonatal intensive care unit, but they only make about half of our population.
It can be a very overwhelming place for new people. When you walk into the NICU, the first thing you're going to see is a lot of buzzes and whistles and bells, and it's like I said, it's overwhelming. However, we need this special equipment to take care of these tiny babies.
We use a multidisciplinary team in the NICU. All of them are specialized, most of them in neonatal care or at least pediatric care, if not specifically to the NI. We have nurses at the bedside 24/7.
The nurses in the NICU have a unique role in that they have to really know how to care for a tiny preterm baby. These patients can't talk to us. They can't say my tummy hurts or my head hurts. What they have to do is they have to have good assessment skills.
In addition to the nurse, we have the physicians, we have the respiratory therapist, we have our PharmD, so she's a pharmacist that specializes in pediatric care, a dietitian who also looks at make sure the babies are gaining the appropriate amount of weight. We do have various therapists that also work with us. We have physical therapists, occupational therapists, and speech therapists that come through the unit every day and work with these babies to make sure that if we start noticing an issue, they can take care of it faster rather than waiting for it to become a huge problem that the baby can't overcome. And then our social worker.
The whole team focuses on the baby and the family, but I focus mostly on what the family needs. It can be basic needs like housing or food, helping them with gas to come back and forth if they live far away. They have decisions to make, sometimes very difficult decisions. A lot of what I try to do is help with that, help them find the resources they need.
When we're on rounds, it's not just me looking at the baby, it's the entire team. So there's multiple minds, multiple eyes looking at the baby so we can provide the best quality care for that baby. Over the years, the outcomes of our babies have improved tremendously. When I started back in 1990, we used to tell parents that a little 28-weeker had a 50-50 chance of surviving and going home. Now with the advances that we've made, a 24-weeker has a 50-50 chance of surviving, and that same 28-weeker from 1990 has now a 90% chance of surviving. As we've gotten better with their ability to survive, they hang around longer in the NICU, and so they take up a bed. For the last 2 years, we've been running on average of 35 babies per year, so we've doubled in the last 10 years. And so we need room for those babies.
The renovation is very important to all of us. It's hard to take care of a baby when you're crowded, and now we're able to put in 20 single patient rooms. This is extremely important because those babies need what we call minimal stimulation. We don't want a lot of noise, we don't want a lot of activity. We also want to make it appropriate for parents and families to visit. This is their child, and we're there to help them learn how to take care of them. And anything we can do to make them a part of our team is very important.
If it helps the family to be there in that space and feel more part of what's going on, to me that's the big advantage.
The most rewarding thing about being a neonatal intensive care nurse is that you get to send these babies home to a family who love them and have waited so long to take them home.
We'll be able to continue to improve the outcomes of the smaller premature babies.
It makes you feel rewarded for the things you've done and how hard you've worked to see these babies.